A little thing I like to talk about is obviously your specialist interest,
Okay,
which is if we can get back onto
Sure.
TMJ dysfunction and TMJ issues, and
Sure.
I suppose a little bit more. Let's say, for instance, if someone was coming in with a headache, what might you see and how might you treat someone suffering with headache?
Okay. Well, it's a big subject, big question. To be succinct and quick, let's
say I've referred someone to you as an osteopath.
Right. Yeah.
I've looked at the neck. There's no issues I can
Yeah.
see in the neck. I've found a little problem with the TMJ.
Sure.
And I've said maybe you should go and see Marc to have your teeth assessed. This could be coming from your bite.
Great.
There's a little intro.
Yeah, I think that, and let's be quick and succinct. I think it all starts with questions. Questions are the answer. That's kind of a cliche that I use a lot. So the better your question, the better your answers usually. And so diagnosis is key. And certainly I'm not somebody who will say that every headache is caused by a bite problem or a jaw problem. Eyes have got to be checked. Neurology, I mean, I often get people to be fully screened. Diet. There's a whole host of weird stuff, supposedly, even chlamydia, that can get into your jaw joints and give you headaches and jaw issues. So there's some pretty out there extreme ideas of what's causing headaches. But let's at least do some quality diagnosis. So it starts with questions. And we have a questionnaire, a specifically designed questionnaire that asks about symptoms of the head and neck and eyes and face and what's triggering those things, for example. Even things like if you chew a bagel, for example, or some really dense food, do you get fatigue or muscle pain in your jaw, or do you find that you don't really chew it, you just quickly swallow it because you know it's going to give you cramp? So questionnaire, it all starts with questionnaires. Then it will start with palpation. We'll just palpate the muscles. You'll have done these things. But with rubber gloves, we like to feel inside the mouth and the muscles, like the pterygoid muscles, that you can feel internally, inside the mouth anyway. And what I personally like to do, I'm one of very few dentists in the UK, and really in the world, that have biometric equipment, where we can put like wireless patches on the face to actually measure muscle activity, just like we do for an ECG. You can do an EMG for your muscles of mastication, and just elicit if there's symmetry in the actual muscle firing, and whether there's actually hyperfunction or hypofunction in the muscle activity. And
hyper meaning too much, hypo meaning too little. Just if you weren't aware.
And a lot of headaches really are driven by a clenching or a parafunction, or we call tooth grinding these days. And just grinding our teeth per se could be causing the headache. There's a lot of research currently being banded out that's suggesting that there's already a temporomandibular joint problem already in place that actually is the instigator and causation or causer of the parafunction. It's almost like the body has to kind of relocate the disc into a better position, especially after a whiplash, a sports injury. Not only is C1 and C2 and the whole cervical chain being whiplashed, but the whole temporomandibular joint complex is being whiplashed, and a lot of discs are shunted forwards or anteriorly, and if they're unlucky, they're kind of permanently locked outside, but usually they slide back in, but with some kind of rupture or tear.
Can I just say there, for those that are unaware, you have a little disc in the joint in your jaw. So what Marc's saying there is the little disc can displace or move, and therefore you get a lack of function through the jaw.
And we understand that with if you're a boxer or a kickboxer, you get a blow, or a rugby player and you get a blow to your face. You can understand that, but not everyone understands. Maybe you get a car impacting behind you in the rear bumper and your head goes forwards and back again, that maybe the jaw has done exactly the same thing as well. So it's kind of new research that's kind of proving that. And we have vibratory software that measures the kind of amplitude of the click. There's a click in the actual joint. And all the click is the disc slipping in and out. And if it's extreme, it will create more noise and vibration, because maybe we're now moving on to bone with no disc in place. So my biometric equipment, I get a little bit more insight. MRIs are great, but they're expensive. They're very questionable about the energy on our body, how that can affect our health. So we have just a simple computer test, and I think that's got to be helpful for me before I decide whether we get an MRI scan taken.
And how would you actually go about aligning someone's bite? Is it reposition the teeth? Is it braces? Is it
huge subject? Yeah. Huge subject. And again, it goes down to diagnosis and what someone really wants to do about things. But if we find out,
so if we have a list of three things you might
start with something that's very simple. The most simplest thing: do a test. Okay. And again, there's a great chiropractor called Jean-Pierre Meserman, who was the medical director of AC Milan until recently. and he set up a chirodontic setup at Macy Milan, where he's combining dentistry with chiropractic, and he set up the measurement test, where you place cotton wool between the two sets of teeth. The patient to just kind of bite on that and then do some muscle tests to elicit whether there is an effect from the occlusion. And if that proves to be positive, then the least someone should be doing is placing something between their teeth, especially at night time, to deprogram their musculature.
So this is what we see in the sportsmen wearing gum shields.
Gum shields, but not just the traditional gum shield. These are kind of Under Armour type ones.
Yeah.
Without plugging too many companies, Under Armour have come out with a fabulous product where there are wedges placed at the back of the molars to just allow the mandible to reposition into its optimum position, so the disc seats in its optimum
And so
place.
that's to obviously realign the neck, and therefore the core functions better because posture improves.
Exactly.
And that is how that would follow on in terms of a TMJ relating to core function, sport function, performance.
Very much so, and it was a bit of a secret. Apparently it was a bit of a secret even in the 50s. All the Eastern Europeans were doing two things differently to everybody else, which is possibly why they dominated sport, the Russians and the East Germans in particular. They were all taught a lot of mind control tricks, autogenic training in particular, which is kind of like martial arts and hypnosis type techniques, but they all knew about the jaw, so they were all clenching on products. And in fact it goes back to the ancient times of the Roman Empire and the Vikings. They all had helmets with leather straps, so when they went into battle they bit on the strap, and they were engaging more power. If 80%,
sorry, I was just going to say there, as a Thai boxer when I was younger, that's exactly what you do on the gum shield. When you've got a standard gum shield in, and rugby players will understand this, whenever you're going to throw a big punch or you're going to connect for a tackle, you used to bite down on that gum shield just for that moment of impact. And what that's doing is that's solidifying your entire system, your entire body. So as you connect, you've got more impact, more force, or if you're trying to knock someone out, then you've got a stronger base to work off of. And obviously we were doing it without even knowing.
Very much so. And if you're not in contact, but you're in balance sports, you'll see a lot of people sticking their tongues out. They're using their tongue as a splint or as a device to reposition their musculoskeletal system from the head down. And you see a lot of basketball, especially with the three-point shots.
Yeah. And I do it with my clients. It was a technique taught to me by Paul Check, and it kind of comes a bit from Qigong as well, that whenever we're doing any kind of supine or looking up exercise, you always have the tongue on the roof of the mouth behind the top teeth, because it reconnects effectively the core of the neck. So you take your head into a nice stable position, and just by gently resting the tongue there, you're not going to drop that head forward when you're doing certain exercises. So bicep curl and doing this, that little tongue just at the top locks everything in place, just like pulling your core in for your lower back. So it's been known for a long time, but we're just waking up to it.
And it's a subject called oral myology, which is used amongst more holistic dentists who are treating temporomandibular joint or jaw joint disorders. They're treating headaches, migraines, redesigning the cranium and the kind of osteo structure that maybe has got distorted from forceps deliveries, from some bad luck, maybe like from dental extractions and some early orthodontics maybe 30 years ago, which was a technique that for them wasn't suitable, and it left them with what we call lesions or distortions in the skull. There are now a multiple range of products that can unravel some of this, but it all starts also with retraining the musculature. If you have a thrust of your tongue constantly outside of the mouth, and we're seeing a lot of people now who are just walking around with their tongues out of their mouth, looking a bit gormless, a little bit brain dead, their mouth breathing, they're not looking very alive, are they, these people? Tongues are out, mouths are open, causing themselves a whole host of disorders. So oral myology is essential for these people, especially like the Buteyko method and oral myology. They go well together, these breathing techniques and muscle retraining programs. So I bring all that into...
That's a huge topic. That's Western Price. That's going back to diet again, and malnutrition and malformation of the maxilla and...
I'm happy to break all this information.
We might have to come back and do another one on that.
But you asked, what do I do? And
yeah,
I think
definitely.
the key thing is, for majority of people who are parafunctioning, keep it simple. There's a very simple little device that was invented a few years ago by a very clever dentist who worked out that we have a reflex that we cannot clench on our front teeth, because our incisors are designed for tearing. Vegetarians just rip grass, carnivores kind of tear meat off bone. And by design, we don't want forces of chewing and grinding going through our front teeth. So luckily we have a reflex that will not allow that to happen. So if we put a pivot on our front teeth, even just a pencil or a pen on our front teeth and try to clench on it, you won't be able to clench. It just doesn't happen. The reflex just releases the temporalis muscle, or the jaw muscle, that elevates our mandible. So there's now an epidemic of people wearing what's called the NTI appliance, which is the nociceptive trigeminal interceptive appliance, which basically reprograms that reflex, so that when you go to sleep, if you are someone who's needing to reposition your jaw and clench and parafunction, you will somehow not be able to do it. You'll slide on the little ramp that's on your front two teeth, and you'll reposition your jaw into a position where you're happy and comfortable, sleep a good night's sleep, wake up with more energy, wake up with less muscle strain and muscle tension, especially around the people who suffer band headaches, and hopefully for a lot of people, less stress and disorder in their jaw joints. It's not a cure always for jaw joint disorder. It depends on how badly damaged the joints are. But if you can take the stress out of the system, then you're going to help start a journey of rehabilitation. But not everyone's going to avoid surgery. It depends on how late they come to treatment.